Hey everyone, I'm Mike Sologub, business analyst at Northwell Health, and I'm going to talk to you a little bit about searching for healthcare in a retail world. Just a little background about me. I'm a business analyst at Northwell Health on our digital strategy and innovation department underneath our in-house marketing agency. I graduated from Manhattan College in 2013 with a BS in healthcare administration as well as in management, and then Hofstra University for my MBA in 2016. Don't worry about my contact info. I have business cards up here, and feel free after the presentation, feel free to ask any questions. I've been at Northwell for about 7 years, starting as an intern. I held various roles: web content assistant, web content editor, experience specialist, business analyst, budget analyst, financial analyst, project manager, product owner, product manager, QA analyst / coordinator, UX, UI, you name it, I've done it. And it's mainly because we have a team of 12. A team of 12 for a large, huge health enterprise, which is Northwell Health. Northwell Health is a nonprofit healthcare enterprise, which is the largest in New York State and the largest private employer as well. We have over 13,000 physicians, 70,000 employees, 750 patient centers, 23 hospitals, a research facility, urgent care centers, private practices. We have strategic partnerships with Cleveland Clinic, research facilities in Sweden, Australia. It's a huge company. It is probably one of the largest health systems on the Eastern Seaboard, as well as the United States. But we're more than just a health system. We're caring for patients in a community of 8 million people, discovering the latest medical and scientific advancements, training for the doctors of tomorrow. We're leading the way. A lot of us that work at Northwell, we kind of live and die by our CEO, Michael Dowling. And one of his famous quotes, as he always said, was, "The goal of Northwell Health is a simple one that has been the same since inception. Be better tomorrow than you are today." So we take that to heart. So today, why are we here? Our patients are fully ingrained in an era of customer satisfaction. I mean, you go to Amazon, you go to Walmart, Costco, any place you go search on the internet, if you buy a product and it does not come in the perfect state when you come home, what do? You return it, you write a review, you go on social media to talk about how terrible this product was, how great this product was. And, we all kind of try to fish for some freebies. Well, this product has a dented box. What can you do for me? Oh, keep it. We'll send you another one. We all know the game. But healthcare is different because healthcare, you can't return a surgery. You can't return a service. You can't return therapy. You can't, you can review it, and chances are it's more negative than positive, but we'll get into that. It's not a physical product that you can take home and talk about. So why we're here today at Activate is due to our project with Lucidworks that I will get into a lot more in depth, but just as a little teaser, we wanted to hit 3 main deliverables. We wanted to improve our relevancy on our website so we can actually get our users exactly what they're looking for. We wanted to integrate something flashy, something good that we already see in retail websites like Type Ahead to direct our users exactly where we want them to go. No more days of misspelling a doctor's name and getting 0 results, because then our patients are just going to hop off our site and go to Google or go to a competitor, and that's lost opportunity right there. And then finally, content groupings. Medical terminology is tough. It's very complicated, and it's scary too. So to just ease our customers in the simplest way by just grouping our content based on the doctor's name. Is it a condition? Is it a treatment? Is it a service? Is it a type of surgery? All these different things help us out. So a big initiative on our marketing team is to transfer into retail. This is a little new in the healthcare space, because considering we're always content heavy, very much like WebMD, your left foot hurts, you didn't step on glass, you didn't go to the beach or anything, you type in, left foot hurts, oh, you have cancer, sick, awesome. Like that, no one comes to our website, as we found through our measuring and analytics, that, to read more about the conditions. So today's retail experience, shoppers expect and have their expectations. Convenience, transparency, quality, cost. Why should our patients completely change their online search behavior just because we're healthcare and not an Amazon, a Costco, a Walmart, Etsy, you know? So I like to think of malls and hospitals in current day very similar. Back in the 80s and 90s, everyone hung out at the mall. I mean, countless 80s dramas took place in the mall. Stranger Things season 3 was just in a mall. If you keep a quick eye out, that is a screenshot from Stranger Things. So the life cycle of a mall, and we can see today that they're dying, is similar to a hospital. Hospitals used to be a one-stop shop for everything. Tonsillectomies, appendectomies, routine doctor visits, to get your medicine, all these different things. And now we're seeing a shift into more outpatient centers, more retailers like CVS, Walgreens, all these different pharmacies that are coming in here and offering a lot of different small services that we used to go to hospitals for. You know, so now with these outpatient facilities, you can get even same-day discharge. Imagine going to getting eye surgery, waiting in the recovery room for a couple hours, and going home. 20 years ago, you were in the hospital for 3 days. And as we know in the healthcare industry, the longer you're in the hospital, the longer you can get infected, the higher chance you can get infected. The higher chance you get infected, the higher chance that you have to stay in the hospital. Rinse, repeat, rinse, repeat. So getting out of a hospital is one of the biggest goals in the healthcare industry today. So from 2006 to 2016, inpatient hospital visits dropped 6%, while outpatients increased by 20%. Fast forward a little bit. Now, today, there's been another drop in 3% of inpatient visits, while outpatient growth increases by 58%. So we're seeing our patients gravitate more towards an outpatient facility, and we're thinking to ourselves, how can we fix our patients in the physical world? Well, as we see with malls today, many analysts estimate by 2022, 1 out of 4 malls are going to be closed. That's no surprise here. I mean, when was the last time anyone went to a mall? Within the past 6 months, raise your hand if you went to a mall. 3 months. Last week. Okay. Thought it was going to be like a lot more hands down, but I digress. Oh, whoops, sorry. Lucky for us, we're adapting to our patients' physical needs, but we're kind of neglecting their digital needs, right? So we're adapting to the market. This is just another slide talking about how the inpatient revenue, outpatient revenue has increased almost 95% of that of inpatient revenue from 2013. So Northwell right now is making that step towards retail, and other health systems are, but I'm going to be selfish and only talk about Northwell today. So to meet our patients' demands, we have incorporated with various urgent care companies, much like GoHealth. We have created our own laboratories on demand, similar to Uber, where a phlebotomist, you open up your app, you need a blood test. Instead of going to a blood testing center or doing it in your physician office, which is usually upcharged by 500%, you can actually have a phlebotomist come to your house, take your blood, does the service, and goes back to the lab to run it. That's convenience right there. That's what our patients want and need. And especially for homebound geriatric patients, that's fantastic. Imagine having your grandma have to get on a bus, go to the blood testing center, wait there in the waiting room, get the blood taken, get back off the bus, get back onto the bus and go home. That's a whole day for some people. Now with LabsFly, they come right to us, they do all the work, and you can enjoy your day. So right now, it was piloted. I was one of the first people to try it, and it worked great because they came right to our office. That will be soon marketed in it's soon available to the whole market in New York, in the tri-state area. I want to say in a couple weeks. It's piloted with just employees only because, I mean, 70,000 of them, you kind of have your pilot right there. But it works great. Vivo Health is also another example, which is a retail health pharmacy in all of our hospitals. So you go to the hospital, you get discharged, you go right there for all your pharmaceutical needs. Or if you live by a hospital, but you don't live by a CVS or Walgreens, you can go right to Vivo Health to get your prescriptions, to get your neti pots, to get your gauze pads and stuff like that. But herein lies the problem. Northwell doesn't have a product per se. We can't have sales and discounts or any true promotions that other Fanatics and Amazons and Walmarts can run. There's no Black Friday for Northwell, right? There's no Cyber Monday. But what we do have, we have services, we have treatments, we have practices, and our largest and most profitable, doctors. Over 13,000 doctors with us today at Northwell. In 2016, the average net revenue generated by a single physician was 1.5. And that's just the average. And this is through the whole, from neurology all the way to internal services. Now, recently released in February, the Merritt Hawkins 2019 Physician Inpatient/Outpatient Revenue Survey showcases and tells us that physicians today handle over 1 billion patient encounters a year. That's collectively, that's not per your doctor, but it could feel like that when you're in the doctor's office. Hello, how are you? What's wrong? Okay, see you. Usually it's 15 seconds. It's terrible, but we're not here for that. So today, on average, it is now $2.35 million generated by a single physician. That's an increase of 51% in only 3 years. Enter Project Addis, or Extreme Makeover Website Edition. What is Project Addis? Project Addis is the small task force we addressed into revamping our Northwell.edu digital ecosystem. Now, we got the name Addis because it's the Greek god of vegetation, and how we've seen in my career, we usually redo the website every single year, which is nice job security. So Addis, it was the repeated cycle of consuming himself, dying and resurrecting, representing a circle of life, very similar to our job and life cycle. So that's why it's called that. I wanted a different name. I lost, but whatever. So what are we doing to achieve Project Addis? We're researching what other retail companies are currently doing on their homepages and focusing more on retail design trends and just getting away from staying in best in our class. We want to be in best in retail class as well. So our team of designers and the creative agency is brainstorming sessions to kind of figure out, if I was a patient, if my father was a patient, if my mother, my children, how can they shop on Northwell.edu? And with that, we want to drive users to individual doctor profile pages. We want to drive users to individual practice pages, increase conversions by appointments requested, appointments booked, and check-ins for urgent cares, for lab flies, like I said earlier, as well as imaging centers. So we have 3 phases. Phase 1, understand the current retail capabilities. What can we do today to get to a retail mindset? Phase 2, build pathways forward, execute on retail light. So basically, 6 months from now, what can we do to get to that retail section? And phase 3 is where the real magic starts. So phase 1, we have to determine what current user pathing throughout our site. How do users interact with us? How can we get them to interact on a retail basis? Define conversion. What is our metric for a transaction on our website? Explore ways to close the loop on conversation. So this is a little bit tricky. We sometimes lose engagement based on, for example, our search not working correctly, where you get no results and you typed in heart attack with 1 T. No results found. What are you talking about? Everyone knows that says heart attack. So getting those misspellings, getting all those loops closed to keep our users engaged and to keep our users on our site. And then identify what we have today to execute on our strategy. Phase 2. So we want to build our forward retail strategy. So we develop it, we try to execute it, and then we ensure these tactics bring us closer to our end goal retail vision that people can, I want heart surgery, take it, put it in their cart, and check out. That's not how it's going to work, but work with me here. Then we use this phase to test and learn into more sophisticated tactics. Rinse, lather, repeat. Keep doing it until we get the best version of our site. So our retail light plan, like I mentioned, it would be Northwell.edu. We want to drive users to our main conversion points. With our Find a Doctor web section, increase bookings by creating a true conversion engine. Abandoned shopping cart strategy is one of the main goals we're working on. You looked at a doctor's profile page, but you never made an action. A couple days later, you go back to northwell.edu. Hey, you were looking at Dr. Saligub. Do you want to make a do you want to call? Do you want to make an appointment? Having those, callback strategies that you get from your Amazons. This is now on sale. We saw that you recently viewed it. If you like this product, we recommend these other products. Stuff like that. And then having a sound SME and SEO strategy to optimize our search links and to drive users back to our relevant pages. And then phase 3 is when we have the brand new site. It looks great. People can transaction on our site, and everything's great. And just as we know for everything, the website's done to work on, we are good, we can go to the next project. Wrong. So just a little more in-depth with Find a Doctor. We would introduce new search features. Others have search, recently viewed physicians, favorited physicians, going on, seeing the ratings from Press Ganey, having all these real reviews from real people talking about these doctors. For physician profiles, we improve CTAs, adding book an appointment buttons, keeping you, when you scroll down, keeping that sticky navigation all the way through your whole entire path and journey through our website. Introducing direct online booking, and then redesigning our physician profiles to optimize and prioritize content. For SEO, especially in our digital ecosystem, highlight search services, cross-sell ancillary services within the ecosystem. For our practices, link directly to practice pages most relevant to the search query. For service lines, highlight information about the service line search, kind of giving our user actionable items to give us transactional elements. So everything you see right here, can anyone tell me what is most in common other than the fact that they're all retail sites? Right? Search is at the center of it all. The first thing you see when you go onto these desktop websites, search. Alibaba, Amazon Business, Walmart, Zappos, Costco. All these places is search with mine. It starts with search. So we could have the best doctors, we can have the best nurses, we can have the best healthcare centers, we could be the best in the world at everything we do. But if our users can't interact with us, they can't engage with us, and they can't find us, what's the point? With this in mind, with our project Addis kickoff, we had to figure out where do we start, because we could have started anywhere, but through our process, we found out that it all starts with search. So just a little backtrack of our digital ecosystem. We started I started here 7 years ago, we started on FatWire. We had about 150 on a mixture of WordPress, Emerge, Ectron. And then we had another 50 on Drupal, as well as, I'll get back to you on that one. But currently, we are on Drupal 8. We have over 15,000 individual pages, including press releases, videos, campaign landing pages, conditions, treatments. And this is not including our 13,000 physician profiles. We have over 20 microsites, and I know you're probably thinking to yourself, what's a microsite in our world? With all of our hospitals, we have a separate cohenchildrens.northwell.edu. It's a separate subdomain that has all new content. So our whole website is so content heavy that you can't go through a navigation. You can't find it on your own. That's why search is so critical. Now, you can't probably see because it's a little too small, but this is a listing of our clinical services, and if you scroll down 3 or 4 times, that's a whole listing of Northwell's clinical services. For an enterprise that large, the amount of clinical services we have is insane. And even on our website, if you go to the navigation, half the page is taken up by the navigational elements. It's even worse on mobile too. You go here, the screen is taken up, the hero is taking up the screen, and then when you click on the navigation, it's just a blue sea of nothingness. So it's clustered, it's clunky. We can't expect our users, especially 65% of them that come through mobile, now that we're seeing that desktop has slowly but surely gotten out of the way of mobile in terms of traffic, our users can't use the regular sitemaps and the site IA to get through it. So this is how we turned search around with Lucidworks this past February. So big problems we had, users couldn't find relevant information. The search was working, but incorrectly. So what that means is the Fusion itself was not broken. Former developers of ours and having senior leaders that want their certain profiles and their certain pages up to the top. Fusion worked exactly how it was intended. We mismanaged it completely. And I know I probably 40% of everyone here has probably interacted with that in some way. Like Fusion, although it's a great and powerful tool, you really have to know your stuff. And we did not know our stuff. So we were prioritizing based on individual senior leadership needs and not business needs. We were using wrong techniques to boost our documents. We just needed guidance. So later on, I'm going to show you how broken it was, but it was our search in 2018 was broken. It was full of irrelevant results. Someone would search TAVR, which is basically putting a stent in your aortic valve to keep it open so blood flow will come in. And the first thing you would come up was cardiology. Now, if I'm searching for TAVR, wouldn't the first thing I want is the surgery TAVR or the top physicians that do it? Why would I go to a service line landing page for that? It just didn't make sense as a patient. It made sense as a senior leader that wanted, their service line to get users in there to funnel in and funnel out, but that wasn't our user's journey. So what do we do to fix it? Well, first we upgraded Fusion. That took a little process. I am not a technical background by any means, so if anyone has any technical questions, feel free to reach out to me after it, and I can talk to our developers and answer all those questions. But we did a heavy emphasis on analyzing our current queries. What was our most frequent? What was our highest volume? Which would actually be the most value-based queries to focus on? We wanted, with keeping that retail in mind, what makes us the most money and what is the most frequent, and find that good mesh in between. Since we really just desperately needed to search, we opted for traditional non-signal relevancy adjustments. However, we do have signals logging. And in 2020, we will be converting more to using signals a whole lot more. A month of consulting, Katie, Kyle, Sean were a huge help with us. Reviewing existing queries with Sean, continuous testing, looking for those fuzzy matches that wouldn't get picked up in Fusion unless the user influenced it. Like myocardial infarction, by definition, is a heart attack, but users don't type in, yes, I just had a myocardial infarction. They talk in heart attack. They use common words. They're not searching how we're thinking, especially being with a healthcare background. A doctor might think, well, why aren't they searching by the original Latin species term or whatever? It's like, that's not how consumers think. That's not how people interact with our websites. So this is TAVR. When you typed in TAVR, About Us Cardiac Surgery came up. Relevancy was transcatheter valve replacement was number 2, and then transcatheter aortic valve replacement was number 3. Those are the two ones that we should have, those should be at the top. Now, just to backtrack, we have a lot of group microsites, as we said, so to combat duplicate pages, we would have one page with different groupings. So if you were under that certain microsite, you would see TAVR under cardiac surgery, and if you were under cardiology, you would see TAVR with the navigation of cardiology. So one of the big things that we saw was our groupings were doubling up or tripling up based on what groupings we had per page. After our engagement with Lucidworks, TAVR comes number 1 as a single one. About Us cardiac surgery, number 2, because that is a cardiac surgery. Like TAVR is a surgery in the cardiac team. And then we also added relevant press releases and relevant news underneath it. Cardiac catheterization, cardiology at Staten Island University Hospital. I can tell you right now, Staten Island University Hospital doesn't do anything related to TAVR. It's mainly at our North Shore and our Long Island Jewish Medical Center. So that coming up in our search result, that's broken. Cardiology at LIJ Medical Center, somewhat relevant. And then surgical hybrid suite at that's a piece of, that's a video. So our site was broken. Our site search was broken, but coming after with Lucidworks, Now we have cardiac cath number 1, interventional cardiology, which cardiac cath falls under, as well as the catheterization program, which is a pediatric one. So you could see that by just making those little adjustments, having Lucidworks come in for just 1 month, our site has completely changed. We also added type ahead. We also added group search. So you can see, I don't know if you guys can see it. It says doctors, condition treatments, locations, and the first 3 letters are HIP. So every time you type in after that, now, and I think of my parents every time they interact with this site, now they don't have to guess what they're looking for. They type in HIP. Well, if I just typed in HIP and clicked search on our old one, it would come up hip surgery. Now to an inexperienced user of our site, or someone scared thinking that they're going to have to get, a hip blastoma off their hip, like how scary is that to be like, oh, well, surgery, that's the only option. So having these kind of having this grouping helped us walk our users through their customer journey to get them exactly where they need to go. So in the future, we're going to be utilizing the true power of signals, and hopefully our boss prioritizes this, and I think he will. And then we'll boost with signals. We'll integrate with machine learning to automate our relevancy tuning, so we don't have to waste our time taking a list, looking at it, going to the top 10 results and saying, is this relevant, yes or no? Is this relevant, yes or no? And then we'll use signals to create strategic calls to actions within search results to limit our click-through and guide our users to what they want to do. So if they're looking to schedule an appointment with a doctor, the schedule appointment button will be right on that right-hand side. If they're looking to purchase an event ticket, that'll be, hey, you want to go to this event? Here's recommended events. Subscribe to our podcast or other types of content. Hey, did you like this? Go to thewell.edu to read more editorial articles. Or simply call this doctor. Also in 2020, we're going to kind of focus on faceted search, kind of how Amazon does it. And we're also going to focus on spelling suggestions like you see Google. I mean, our users and everyone in this room, how many times do you just Google something because you just don't want to go to that person's website and go look through it? So this is a perfect option of having for our on-site search. So in conclusion, the goal of Northwell Health is a simple one, and that has been at the same in its inception. Be better tomorrow than we are today. Damn it, I messed that up. Our retail transforming shows us that we're willing to be better than we ever were. We're constantly adapting, improving, and innovating to give our patients exactly what they need and when they need it. So thank you. You guys are my first ever conference presentation. So please, 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 please provide feedback. Questions? I think we have like 100 minutes because I blew through that whole thing. What's up?
What was the name you wanted for Addis?
All right, so yes, what was the name I wanted for Addis? I wanted Project Everest because it would be, you keep going up the summits and you would kind of, get to that, point, and then I lost that. It was a terrible name. Anyone else? Yeah, so our digital patient experience team is currently working on self-scheduling, but with 20 different hospitals, and they're all legacy systems, and having doctors' individual practices. It's just trying to get them all on the same data source to kind of to get that user interface perfectly, because we don't want to roll it out and then someone be like, this doctor's not taking it for 6 months. And the doctor's wondering, why don't I have patients coming in for 6 months? And it's kind of, we want to really limit our gaps to ruining that conversion before we even get there. So it is on our docket, but it is a bit complex.
Can you talk a little bit about where these different types of data live in terms of the data repositories that are being called by Lucidworks?
So he asked where the different types of data live for the different repositories they're being called by Lucidworks. So we have our credentialing system through Northwell Health. That's a completely different department for every doctor, fact-checking every single doctor's credentialing, their phone number, their locations, what type of patients they get, their clinical focus terms, all these data sources coming in. We have Echo is one of our other data sources that kind of get all of our location data management. So it's on the doctor side when they put out their profile, that goes to a certain database. And then it's also on like the facilities management side that feed in to make sure that we have the same interlocking information, as opposed to a lot of other ones. But if you email me that question, I can get you a super true answer from our developers.
It's a big one.
Yeah, so I was like, ooh. Any other questions? Well, oh,
You said you have a 12-member team, right? Like how many of them are data scientists, developers? What's the composition?
all right, so he asked about our team. So I'm going to shock you. We have 2 business analysts. We have 2 front-end developers. We have 3 front-end developers, 2 back-end developers, 1 UX person, and then 3 production people and 2 QA analysts. So to answer your question, we have no data scientists. So we are all, as I showed you before, all those different roles we play. Everyone on my team could probably have a list much longer than me, because it's, as a healthcare company, we can't invest too much into that, because we're a digital innovation. We can be seen as kind of a nice to have investment, not so much like our health system needs doctors, it really needs nurses, and it needs people that take care of our patients. Having kind of data scientists, they kind of look at that and say, maybe when we get a little bit more money. So we have 0 data scientists.
So the interfaces that you showed when you said we're trying to do the same thing as retail companies.
Yeah.
Have users actually used that interface yet, or is this a work in progress?
So we're still designing it, but I can actually show you a little sneak peek.
The reason I'm asking is because as a user, I might not want the same experience as retail.
Mm-hmm.
Because it's a different goal. I mean, it's good to be inspired by these companies,
Right.
which I personally don't love their search experience, but even if they were great, I don't think it would make sense to copy it as it is into healthcare.
Right.
Because I'm not always interested in, like, if someone is searching for left foot pain, people also search for heart attacks, right?
Yeah.
Or
Yeah.
if someone bought some, kneecap or whatever, right? Or some sort of something for their knee, they also bought some sort of, other. So it's not, apples to apples.
Yeah, totally. I mean,
I would say, maybe doing some focus groups or whatever, some sort of more investing into that would.
so we actually have had some focus groups kind of come in and tell us that it's more of their expectation, not so much their wants of our website. You go to Google, you go to Amazon, you're not clicking through the sitemap. So I agree with you. We don't want to become like, the flashy neon lights on the other side. Call us now, call us now. We want to be more focusing on today's user behavior, online user behavior, because our behavior has changed throughout the past year, 5 years, 10 years, 15 years. I mean, people interacting with the internet today were different 5 years ago, 10 years ago, and when it first started. So it's more, not so much, you're right, we have to kind of curtail our expectations of our patients, but we also have to meet them a little more halfway at what they're expecting, not so much selling them and ramming it down their throats. What's up, Kyle?
So this is kind of outside of Fusion.
Sure.
How did the team walk us? Maybe talk a little bit about how a team of 12 changed senior management for 70,000 people to go from having what their wishes were to where you got everybody on the same page to focus on overall business's goals.
Yeah. So Kyle's basically saying, how did we kind of get to the point where now they're actually believing, like listening to us? So like I mentioned, over the past couple of years, throughout my years here, and we've migrated all these different websites in my tenure, we've had the 6 different homepages in 5 years. So it's kind of like we're doing something wrong if we're constantly changing. We're not constantly improving. We're not constantly tweaking and polishing. We're changing our website year after year. I mean, every December 31st for the past 5 years, it's been like, are we launching a website? Are we launching a website? Yeah, okay, we're launching on the 31st or the 30th. Okay, I just gotta make sure for my New Year's Eve plans. So yeah, basically our senior leadership team is just tired of having to waste all this money and manpower into migrating brand new sites, and we want to completely blow the healthcare industry out of the water and go toe to toe theoretically with Amazon and Costco. Not so much in sales and revenue, but more for user interaction and user experience. That kind of answer your question?
How did you sell that vision?
So thank goodness.
I'm a cardiologist. I want you to come to my landing page versus a
Bingo.
cardiologist. Like, how did you convince those guys to get onto this is for help those
Right.
all?
So our chief marketing officer, Ramon Soto, has been one of the best leaders at Northwell that I could ever remember. He goes in there and tells them exactly what needs to happen. And he simply just says, like, we can do this now, or we can do this in 6 months when NYU, New York Presbyterian, and Columbia are doing it. So you make that decision. We can wait and be seen as the followers, or we can be ahead of it and be first in class and top of our industry. So I just want to show you, this is our current homepage right now. So we have our hero anchors, popular links, very wordy, some pictures, a lot of links. From this point, you can get to 57 different links on our homepage. And now, whoops. This is our homepage version 1. Whoops. So it is all there's animations to go with it. But the first thing you see, without even scrolling, find a doctor now. And it's an actionable item. If you're coming here to find a doctor, you don't have to go anywhere here. Our top navigations: find care, billing, education, innovation. Once you get past that find care and billing, those are the nice to haves for our senior leadership. Our education, our whole education wing with like 4 professionals. Our innovation team, which is our Northwell Ventures, or our new our innovations lab, as well as giving a gift. And then when you come down here, it's just some nice animations. This is our nice to have. And then for our current find a doctor profile, so if I come here, and find a doctor, I don't know what's here we go. So this would be a regular doctor's profile. Actually, let me get a picture. Sorry, it's taking forever, but it's very bland. There's no call to actions on here, except if you were the physician right here. Is this your profile updated right now? There's no call. Oh, see insurances, that's great. I want to physically make an appointment with this person. Versus, this will be our new sneak preview. First thing you see is a phone number, request an appointment, which will be make an appointment in the upcoming, about all information and videos about this doctor that people want to know. When you come up here, and then this will be kind of an accordion. Credentials, area of focus, English. You can find the insurances as well as locations. Also, if you can't make a appointment with this exact doctor, meet his team. All of these people that he refers his patients he can't get to. So it's constantly keeping that retail focus in here to make sure that our users stay on site and make actionable items. Just more patient relating. So this is hoping to launch October-ish, but yeah. Does anyone else have any other questions? What's up?
I just have a really quick one. Are there other health systems that you guys look at and think are doing a tremendous job with this kind of patient experience, easily finding information on the website type of challenges?
Yeah, so we have a saying at work, NYU does it. Why can't we be like NYU? Our chief marketing officer if anyone ever says that, like, he will physically grab you by the collar and throw you out of the building. He hates hearing, well, why can't we have it like NYU? And the doctors chirp at him and say that. And he has made it his personal mission this year to completely eradicate that saying from our office, because it angers him. It angers me too, because you want to be the industry leader on your team. You want to make sure that the company you work for, you have a little gusto, you have loyalty to it. You want to be the best in class. You don't want you don't want to be dragging on someone else's coattails. So NYU would be definitely that answer. Anyone else? So we have our customer insights and analytics team. They've been gathering dashboards. So as soon as we hit that switch, it's just measuring over 3 months, 6 months, how of our conversions, especially with our UX team, which is one person at this moment. Our conversion for us would be the user clicking on our website and going to that appointment. So abandoned appointments, we wouldn't even count because we can't know until we get that. And it also relies on the whole self-scheduling. So if you can schedule that appointment, you go to that doctor's office, the person behind the desk can click, okay, this person's here for their appointment. We know that that person scheduled an appointment on our website, went to the appointment itself. So then we can start tracking that whole customer journey. Exactly. Yeah. Anyone else? All right. Well, I thank you so much. Please, please, please give feedback in the app. I was told so. All right. If you have any questions, my business card's up here. And have a great day.